So I came in at 4:45 this evening, and we've had 3 admissions since then. So we admitted a guy with painless jaundice who concerned for either like hepatitis or maybe like a pancreatic cancer, some kind of a sad deal. And then we're seeing a guy that has sepsis, likely secondary to IV drug use. And then our other patient that we're seeing has a new mesenteric mass with kind of recent onset ascites as well. So a few different kind of interesting cases. My name is Eric Anderson, and I'm a 3rd-year resident at Via Christi Family Medicine Residency. So I am the senior on our inpatient hospital medicine service. I am currently on my week of nights. Usually for half of the month, you're rounding on patients in the hospital, doing admissions during the day. 1 week you're doing nights, get checkout from the people who are on during the day, and you manage those patients at night as well. You take all of the admissions overnight. Usually it's a little more busy, kind of fun though, because you get to do the things that need to get taken care of now and are a little bit more exciting. And then the last week is what's called the swing week, where basically you're in clinic in the morning, and then in the afternoon, evening, you come to the hospital. You're just there for admissions. We usually cap our service somewhere between 12 and 16 patients. That kind of goes up throughout the year as the interns get more comfortable with seeing more patients. We work at 2 different hospitals. St. Joe is more of kind of a community hospital that we work at. It doesn't have all of the resources and specialists that you would at a large tertiary referral center. And we do our nights here at this hospital. So people we admit over here are the typical stuff that you will see in rural settings. We still have the specialists, which are just right across town. So if we have very sick patients, we will send them across town to our medical team, which is over there as well. That is our same service. But it's kind of nice because it is what it will look like in a lot of our future practices. And then we split our work at St. Francis, which is a level 1 tertiary referral center at St. Francis, our open ICU. So basically we follow our patients wherever they go. I was taking care of COVID patients in the MICU, treated for COVID pneumonia, and basically I was managing those patients, and ID and pulmonology were helping significantly with their care, but we were still the primary team. And then we actually had a couple neurosurgery patients on our service as well, so we were working with neurosurgery to help manage post-op care, maintain blood pressures in the appropriate range to prevent herniation and some of these things that are not very common. And so it's nice to be able to work at both hospitals where you still get the very complex cases that are interesting and kind of challenge you in medicine. But it's also nice to have the patients over here at St. Joe, which are, kind of your run-of-the-mill things, but to be able to manage patients without as many resources. We do a number of different in-hospital procedures, thoracentesis, paracentesis. Usually our intensivist will let us work with them as well to do intubations, central lines, some of the emergent procedures like lumbar punctures, INDs, other things that we get to do in the ER. We communicate with them pretty frequently, so if there's opportunities to do that, usually they're more than willing to give us a call to come down and help out. Wichita is a great family medicine community and just a great medical community in general. Whenever I, call Dr. Shaheen for a cardiology consult, he always, responds, Dr. Anderson, thank you very much. We're going to be happy to see them. It makes you feel like you're appreciated and doing good work. Dr. Musa is our nephrologist who works very closely with our program, sees a lot of our patients, and he also lectures us. His lectures are amazing. He's a big reason why I wanted to come here and learn medicine, because he's a great teacher along with the rest of our faculty. And it's very rewarding to be able to have that support. I feel very well prepared for what I plan to do in my future practice. I am going back to my hometown to work actually. Basically the hospital is attached to the clinic, and so I will be doing outpatient medicine 4 days a week. I will be doing inpatient medicine when my patients go into the hospital. I will be doing OB with C-sections, and I will be doing scopes as well. So all of the things that I had planned on doing, I will be doing when I go out into practice. I feel like I've got great training here to feel confident in doing all of those things. This is Anderson. So we just got called for a stroke code, so we're going to go see that patient and quickly do a NIH stroke scale on it. Alright, so it seems like that guy might have a legitimate stroke, so we're going to call the neurointensivist on call tonight because he likely will need TPA, and see if we can push TPA and get him transferred over to St. Francis.